Welcome to the Healthy You podcast from North Shore University Health System, where we explore trending topics in healthcare. I'm Carolyn Starks.
And I'm John Hillenbrand.
Today we're speaking with Dr. Georgia Spear, and she's going to talk to us about using artificial intelligence to detect breast cancer at North Shore. And since October is Breast Cancer Awareness Month, we're going to talk about screening, the latest in screening, and this is geared for patients and what you need to know about the latest technology and advances for when you go get your mammogram.
And cool cutting-edge technology if you're into that stuff.
Yeah. So welcome to the podcast, Dr. Spear.
Thank you so much. Thanks for inviting me.
So what is your title at North Shore?
So I am Division Head of Breast Imaging at North Shore University Health System. I'm also Clinical Associate Professor of Radiology with the University of Chicago Pritzker School of Medicine.
Ooh, nice.
Okay. You know what? Let's talk about the difference between a mammogram and an ultrasound. Because a mammogram, I'll say this for Dr. Spear, and she'll hopefully agree with me, is a low dose of radiation to take an image of the breast. And that's where the tissue is compressed against those plates, and then they get a image, so they get the best image to be taken. And then an ultrasound uses high-frequency sound waves and converts them to an image. No radiation is involved. So is one better than the other?
That's a great question, and you were spot on in your description.
Thank you.
So
thanks, Wikipedia.
So it's exciting. So in breast imaging, we have multiple modalities to use, and so we use them for specific purposes. Our gold standard for breast cancer screening is mammography. Mammography reduces mortality and deaths due to breast cancer by 40%. Ultrasound is a fantastic tool, and we use it daily in our practice. We use it on both a diagnostic basis to identify areas of concern in the breast, but we also use it for screening at North Shore University Health System, and we're fortunate to be pioneering in the screening realm with automated breast ultrasound. So there isn't a better modality. It's really how we use each modality to find those cancers early, when they're treatable, when they're manageable, and give women a quality of life.
Is ultrasound only used if you have dense breast tissue?
Automated breast ultrasound in our specific practice is used for screening when you have dense breast tissue. But ultrasound is also coming in a different variety, and it's handheld, and we perform it in our office on a daily basis for diagnosis of areas of concern within the breast.
Oh, I didn't know that.
Okay, so you would probably have had a mammogram first, and then the radiologist said something looks suspicious?
Yes. So there's two pathways, and
Okay.
I could explain those briefly. So the gold standard, again, is mammography. So we want every woman to start with mammograms at the age of 40 if she's of normal risk for developing breast cancer, and get a mammogram every year. Now, if she comes in our office and we see her mammogram and she has dense breasts, and she comprises that 40% of women that we screen that have dense breast tissue, well, mammography alone can't catch all those cancers. So we use automated breast ultrasound, which is a newer technology, and we've been using it for the last 6 years at North Shore, to use it as an adjunctive screening tool with mammography to find those cancers in women with dense breasts. Now, that is separate from diagnostic ultrasound. So if a woman comes in and they feel a lump in their breast, or if the physician who examined her felt something in her breast, she'd come in, we'd begin with a mammogram, and we would do what's called a targeted handheld ultrasound using a different it's not the automated breast ultrasound we just described, but handheld ultrasound. We would actually penetrate the tissue with those sound waves and look for an area of abnormality if it exists, and give our recommendations accordingly.
That
It's
makes
like
sense.
similar to getting an ultrasound if you're pregnant.
Very similar to if they're looking at the liver, they're looking at the kidneys, they're looking to do an OB ultrasound for pregnancy. So there are two varieties that we have at North Shore, but also this diagnostic, this handheld ultrasound has been a mainstay in breast imaging for decades upon decades.
Cool.
Excellent. So John and I are really excited to talk about artificial intelligence, mostly because we don't know what it is. But
I only know AI from video games.
yeah. And how North Shore is using that to help detect breast cancer.
So artificial intelligence is such a buzzword, right? So
It is.
It's exciting, but really what it is gathering information from imaging, from, consecutive imaging or just large volumes of imaging, and collecting that information to tailor a specific software to do a specific task. And one of those tasks could be to detect breast cancer. So the software would learn from prior cancers that it's seen in images, and you'd feed it volumes and volumes of these images. And it would get really good at helping to hone in on areas of abnormality. So that's an exciting area to delve into with breast cancer.
So you show the computer like positive images where this is cancer, and then other images like this is not cancer, and then eventually it starts to learn.
Yeah,
Yeah.
it starts to learn.
Will this replace you?
That is a great question. Well, I wish it was as black and white as you mentioned, right? Like this is positive and this isn't. Well, it doesn't really work like that because tissue is just so complex. But will it replace us? I don't think so. So we really need to put together that whole picture. We need to bring in our clinical expertise, our knowledge to really identify how to manage patients in the best way possible. I think AI is in our future. We use it now and it's in our future because it really will help us do our job more effectively, more efficiently. It will really help us because the value that I see as a physician is really spending time with that patient, educating that patient, finding out what the abnormality is. So if we can improve our processes to do what we need to do with our computer systems, then we can spend that time with our patients and really take care of them in the best way possible.
Plus, I'll have to remind all of you that Dwight Schrute won the paper selling contest against the website.
Oh, nice. That's a
So,
that's a
for all
good
the
reference.
Office fans out there, proven that computers will not take over. So let's talk about exactly it, for our patients to know. I mean, there's a clinical side of this, but for them to know, how is this helping you?
Yes.
And how do you use it?
So one of the avenues of AI that we are using currently at North Shore is in the realm of automated breast ultrasound. When we perform these types of ultrasounds, we use special technology, a special transducer that is large, that occupies a large portion of the breast so we can obtain all the images of the breast tissue. And then what happens is once we acquire these images, they are processed in a 3D processor. So we can see these volumes in 3D plane.
Cool.
But at the end of the day, when you have a patient who comes in for one of these screening breast ultrasounds because she does have dense breast tissue, we're acquiring upwards of 2,000 or 2,500 images on that breast.
Wow.
And so if you can imagine, we are using this technology at a workstation, and we are trying to find a 3, 5, 7 millimeter cancer within all of these images. So how does AI help? Well, it can help us by identifying maybe areas of abnormality, by marking them for us so we can delve deeper into that area and be really efficient in our search. Is it perfect? Well, we're aiming for better and better every year. But really the reality is we know what constitutes an abnormality by visually looking at an image, but we want to hone in on the areas that might be most substantial to really find that abnormality.
So could it pick up a slight change that would be invisible to your eyes? Like, here's a slight change in breast tissue that correlates with the thousands of images this AI has in its so-called brain.
Yeah, so I think, the reality is that if you point an abnormality to a radiologist, that's our training, that's our expertise, is to look for subtle abnormalities, right? But again, because you have so much volume of images hitting your sight as you're visualizing this, that AI system can hone in and make a circle around something and say, look a little deeper in there. And then you look in that area and then you can identify, was that an area of scar or is that something that we need to call back? So we have that expertise, that visual expertise, but why not help us really hone in to find those cancers early?
It's like radar or something.
So do you remember a specific instance where this really, really helped a woman?
Absolutely. I would venture to say that when we find a cancer on automated breast ultrasound and we don't have that abnormality seen on mammography, which is the gold standard for screening, we have helped that woman because we have found that cancer when it's small, when it's clinically significant, and it will impact her future life. So I do have a patient in mind. In fact, let's rewind back to 6 years ago when we started the program. Within the first few months of the program, I recall reading an automated breast ultrasound on a woman with very dense breast tissue. You could never find that cancer on mammography, and she would get mammograms every year. And she came for her automated breast ultrasound, and I remember finding a very small 5 millimeter cancer. And it happened that I was with her during the trajectory of her care. So I was there for her biopsy, her localization prior to her surgery. She had surgery, a lumpectomy, which removed the affected cancer, and she is happy and healthy today. But one of the most just kind of poignant memories that I have is the patient came to me and presented me with a gift, which I didn't want to take initially, but I opened it up and it was a small clock. And she said, "I'm giving you this clock because you gave me the gift of time."
Oh, wow. That's great.
Oh my goodness. Wow.
Nice.
So if that doesn't really drive you to keep pushing forward with new technologies, new advancements to find those cancers early, I don't know what does, but that's why we do what we do.
You've contributed so much in this field. Talk about, is there any kind of legislation now that you're working on?
So I've been involved in legislative efforts quite a bit. I helped pass the dense breast notification law back in 2018 here in the state of Illinois, just to notify all women of their tissue type, right? So it's really, really important for them to know what tissue type they have so that they can be more proactive in their care. We also, a year later, I helped pass one of the first laws for diagnostic mammography coverage because, economic disparities and healthcare disparities are so prevalent, and we really want to provide equitable access to our patients. So that was a really exciting piece. Since that time, so basically what that does is cover diagnostic mammography as part of wellness. So patients would not incur an out-of-pocket cost in addition to having insurance so that they can get that diagnostic mammogram to make sure we rule out cancer or potentially even rule it in. So since then, I've definitely been involved in numerous realms, helping other states actually pass similar legislative pieces. Most recently, I was communicating with Tennessee, but we helped Texas and Wisconsin. I've made efforts up there as well, and other states as well to just help propel advocacy within the physician realm. It's so important for us to be active in this realm because we are the ones who have the knowledge and the expertise to really make substantial changes. And in conjunction with patient advocacy and other lobbyists as well, it's great to be involved on that end to make an impact.
That's great. And we talked a little bit about that in the last time you were here.
Yeah.
Yeah. So if you want to hear more about that, check out our previous podcast.
Yeah, and thinking about it, I don't think dense breast tissue as a layperson was even in our vernacular like 10 years ago. It was not commonly talked about. And
Right.
I think you're a big part of that becoming a common conversation now in offices. And because as you know, the information is widely available online, right? So we're all educating ourselves. We can't leave without telling people and encouraging them to get their mammograms and setting up the guidelines and just reiterating what they are, what age they start. And so can we walk through those one more time?
Yeah, absolutely. And I think this is the perfect time to do so because really the reality is that in order to find those cancers early, screening mammography is the way to go. So we want to encourage our women to come in for their screening mammograms. For women who don't have a family history of breast cancer or concerns that they may be at high risk, we recommend they come in for their first mammogram at the age of 40 and come in annually. And that's how they're going to achieve those life-saving benefits of screening mammography, to find those cancers early, to reduce mortality due to breast cancer. And I know all of us have been so deeply impacted by COVID in the recent years, and many patients really, unfortunately, didn't have that access to the health centers as readily as they did before COVID. And so we know by experience that we are finding cancers at later stages if women miss those mammograms. So we want them to come in every year, starting at the age of 40. And if a woman has a family history of breast cancer, I definitely urge her to speak with her referring physician, whether it's her internist or OBGYN or family practitioner, about having a visit with our high-risk breast clinic, because we want to identify her risk status. Because if she is at high risk for developing breast cancer, we would want to know this because we would add MRI, breast MRI, as an additional screening mechanism in addition to mammography to be more sensitive in finding those cancers because she would be at higher risk. And then, of course, the third caveat is if a woman has dense breasts and she falls into that category of the 40% of women that we screen of having dense breast tissue, we know that mammography alone can't catch all cancers. And so we would want her to come in for her screening breast ultrasound to give her the best chances at finding that cancer early.
Can you repeat again who is supposed to tell a woman that she has dense breast tissue and how is that communicated?
Yes, that's great. So anytime a woman comes in for a screening mammogram, whether it's her first or second, her 10th, on that report, we notify the woman of her density. And then there's a letter that goes to her, actually, to her and to her provider who ordered the exam that states that if she does have dense breasts, we make that recommendation that she can come back for supplemental screening. And we explain what dense breast tissue is. So we have a mechanism in place to inform our patients both through the letter they receive in the mail with their results, and we notify their physicians. So we urge our women to come and ask us any questions they may have in the breast center, and we will definitely guide her to the right tests.
You said you've been using AI in the past. This is not your first rodeo. So what other things are you using AI for?
So we've had some computer-aided detection that we've been using with mammography for many, many years. And then I know we hit on the ABIS technology that we're using currently. And we're also delving in on an even deeper realm with AI, with deep learning algorithms that help us improve image quality during mammograms. And so we are using a specific software that helps us at the time that a woman is having that mammogram taken, and it's giving feedback to the technologist. We didn't get enough posterior tissue in that breast. Maybe we need an additional image, or this image may not be of best quality because there might be some blur. We can actually identify those discrepancies, and we can actually give that feedback to the technologist. We can make sure those mammograms are optimized at the time that they take them so that we can actually interpret them in the best way possible. The better our images, the better our interpretation at the end of the day to find those early cancers. So that's another realm. And there are many additional realms that we're dabbling in, whether it's related to identifying a patient's risk. We're actually performing some research on that at the moment. And can AI help us better identify a woman's risk? Because at the end of the day, what we want to do is really personalize our care. It's personalize our screening for our women to find those cancers. And the way we can personalize that care is to be really specific about what a woman's risk level is. And then based on that risk level, we can stratify a woman's regimen for screening and tailor that screening to be right for her. So again, to find those cancers early.
See, I love the use of personalized with AI because of personalized, sometimes we think of that's your physician sitting down with you, connecting with you. And here's a great way for technology to personalize it. And then it's the physician's job to communicate that, effectively.
I also think it's interesting because I use Photoshop a lot in my job where I'm a photographer, and the tools that Photoshop is using, a lot of them are AI based, and they're just getting better and better every single year. And now sometimes when you have to cut someone out of a background, it can like tell where the little individual strands of hair are, and it like just the image analysis is really incredible.
It's pretty incredible, actually. It's kind of exciting to be in a field that really merges clinical medicine and technology, and really it's now become one. So
yeah.
Well, with that, can you predict 10 years from now what the impact will be and what you hope to see?
Gosh, I think, 10 years from now, we've moved so far in such a short period of
know.
time.
Right. Yeah.
I can't even imagine 10 years from now. Are we going to have holograms telling us exactly
Right.
what our care pathway should be? No, but the reality is I think we are going to be really effective in triaging patients and really being more specific in our ability to target what needs to be found or what needs to be done in order to find cancer. And it's an exciting time to be in this field, I must say, and looking forward to the future.
I like one of the things you said about how it helps you like streamline your like interactions and figure out which patients you need to pay more attention to and that sort of thing. That seems really interesting because I'm sure as just there's more humans on Earth, you're getting more and more patients every year. Can you talk a little bit about that?
Absolutely. I think, and also as our healthcare institutions become larger, we really want to provide the best in care to every individual. And even not only just providing care to a large number of patients, but really providing it equitably. Can we identify areas that require improvement? Can data science give us that information so that we can target specific populations to actually be more effective in our screening? And we're already doing that. So from a health equity perspective, from a patient access perspective and a patient care delivery perspective, I think, we are really entering a new era.
That's
For
great.
sure.
Cool.
Well, thank you for being here once again. We can link back to our first podcast.
Yeah, I'll put a link in the description.
Yeah, but this definitely moves the needle so much more forward from the first time that we recorded in.
Yeah, absolutely. Thanks for being here.
Thanks so much for having me. Great to see you all.
Great to see you.
Hey, if you have any topics that you'd like us to discuss, email us at publicrelations@northshore.org, and we'll be happy to get to those topics for you.
You can also follow us on social media at North Shore Web on Instagram, Twitter, or Facebook.
And see you next time.